Hello and welcome to the BusinessTech Times. My name is Moksha Mechanda from GDG West Sweden, and I will be your host for today. For those who don't know about BusinessTech Times, it is a show that shares the same model of GDG, that is the Google Developers Group, where we believe in contributing to the progress of the community with respect to adaptability and scaling through dialogues about businesses, technologies, and professional journeys. So before we begin, I would like to address the current situation the entire world is facing, COVID-19. To avoid the spread of the virus around Sweden, I have decided to host the show via video conference call. So you guys might wonder how I'm going to do that. Well, we will see. Our guest for today is Mr. Hugo Dürr, a public and community health specialist. A warm welcome to you, Hugo. Good to see you.
Thank you, Moksha. Lovely to see you too.
How are you?
Very well. It's a little bit odd to be sitting digitally like this, but I think we'll be adapting just fine.
Yes, it's for the good.
Absolutely.
So I would like to know, you're the Vice Curator and Secretary of the Global Shapers community. What exactly is this community all about?
Sure. To mention, the Global Shapers community is it's a global community of different hubs. So I am Vice Secretary of the Malmö Hub, so of the Malmö organization here in South Sweden. It's an organization that's based and initiated by the World Economic Forum in Davos about 10 years ago. There was a big stakeholder analysis that was done of the global actors or the important actors in influencing the world affairs.
Mm-hmm.
And from this analysis, youth came up as one of these 6 key actors. And of these 6 actors, youth was also one of those that the World Economic Forum felt did not have a sufficient enough platform or a direct enough link to the forum. So the Global Shapers community was started out of that. And so it's grown now over the past, 8-9 years, I think. And I just checked today that there's about soon 10,000 members in 150 countries with about 400 different hubs. So
Wow.
Each city is based at a hub level, and the whole purpose is to drive change and work for dialogue and improvement on a community level. So that's why we're community hubs on a city level and not national organizations. So that means that we in the Malmö Hub, we started last year, and we aim to drive community impact projects on a local level, addressing the needs that we know to exist in Malmö and in the region around us, to give a specific and specialized and detailed enough approach as possible. So that in large is what it aims to do. Very, very grand ideas, I think, and for the name as well.
That's very interesting. So are you guys trying to make it like nationalize it?
Well, the idea is to keep it on as local level as possible. So there are other more established hubs. There's an organization or a hub in Copenhagen that we're working with a bit. There's a Stockholm hub as well that we have communications with. But the idea is to work on a local level where possible, and to have collaborations where also necessary. So a project that we're working on in Malmö, I mean, we know there's huge diversity in Malmö's demographics, but that's not often represented in business leadership. So one of the projects that we have going on is to link youth from diverse schools with business leaders in terms of, sort of call it some kind of reverse mentorship. That's at a high school level. So that's with the aim to show pride in the demographics and the diversity that Malmö has, and create a link between youth and future work.
Wow.
That's on a local level. Then we're working together with the Copenhagen hub and a bunch of other hubs around Europe on some kind of collaboration with the WHO now in COVID-19 times.
Nice.
Tackling the infodemic and false information that's out there. So it's both on a local and on a international level.
Well, good luck with that.
Very
And I recently heard that your family is running the retreat center called the Curator,
Mm-hmm.
which aspires to be one of Sweden's largest and most high-class yoga studios. So what does the name Curator mean?
So the name itself directly translates to hill field, and Gård is a farm. So the hill field farm is the direct translation, which doesn't roll as nicely in English. But it's essentially, it's located out on the east coast of Skåne, on Österlen, which Skåne is known to be quite flat, but out here it's quite hilly. So we're located up on a high hill, overlooking the sea, surrounded by fields. So the name, I guess, is fitting for the location.
It must be beautiful. So it's a family-run business. So who exactly is behind the project?
So it started. The vision for it has been in the making many years, but its actualization, its realization has come about in the past year and a half, roughly. So my mum and her husband have bought this place about 2 years ago, and have been rebuilding and renovating and launching their dream since then. So mum has a large background. Her entire life is in wellness and in yoga and in mindfulness and in healthy eating and life coaching and all that aspects. And her husband is an old not realtor, works in branding and design and architecture, and has an eye for marketing. Okay. So there, and is award winning in his history, working in ad campaigns with H&M and with other global corporations. So the two of them, with their call it the yin and yang, the mindfulness soft spirit side with the beautiful design and everything that comes with it. Together, they've created this space for mindfulness and yoga retreats specifically, but also as a conference center, where we're right now, in this summer, we're having to readapt our schedule quite a bit. As you imagine, with not being able to gather big groups. So we've adapted our groups to 8 to 10 people, where the whole point is to allow people to come to a safe space, which is close to the ocean, close to nature, which has a very shamanic connection in its history, where indigenous peoples lived out by the national park that we have just close by, which is Stenshuvud. So there's an incredible aura just in the earth around, but couple that with personal development and beautiful design for a space to have as a place to recharge and to just rediscover yourself. It's
I think once this COVID-19 situation is over, I will definitely go there and spend some time.
Absolutely.
I think it will be lovely.
It is highly recommended to anyone listening.
That's great. And you worked at Medical Teams International. So would you like to tell the audience what Medical Teams International is all about, and what were your responsibilities there?
Sure. So Medical Teams International is an international NGO based out of Portland, Oregon, in the States. But they do health and humanitarian programs all over the world. So as a health-based NGO, they work in many different fields, but primarily 3 different areas, and that's health system strengthening, health systems, capacity within health systems, and direct health services. So there are 3 main pillars of their work. And during my research, during my master's program, I was based in Guatemala, where there's a MTI project that works particularly in health system strengthening and building capacities within healthcare personnel. So in communities, rather, sorry. So it's community health engagement and direct health services. And there we were starting up a 4-year maternal and child health program. So I arrived just at the start of that program. So we were identifying our communities to work in, gaining access to speaking to local leaders, and then rolling out the baseline study to get an understanding of what are the current health needs and health knowledges and health practices in a community. So with that baseline study that we conducted for about 2 weeks, we had a data set or a foundation to know what practices should we aim the program at, and also allow us to measure development in health knowledges and health practices throughout the 4 years. So it was a massive program that, as I said, is a 4-year that's coming up in its 2nd year now, and has the direct target audience about 20,000 with an impact radius of almost 200,000. So it's a hugely impactful project, and MTI is doing a fantastic job. Simple as that.
That's great. So there might be a lot of projects upcoming now. Probably.
Well, there was recently a project started out in Colombia, sorry, to deal with the Venezuelan crisis, or to deal with the large influx of Venezuelan migrants or refugees into Colombia. So that was a project that started up went out rolling in January this year, which I had the opportunity of partaking in, but didn't fit with my timeline. But there are projects that they start up with, and there's more funding and more money coming in. So there's a lot of work that they're doing, and excellent work, not only within health, but in humanitarian aid as well.
Okay, so I would like to know, how is this moving from one project to the other and meeting different kinds of people? How is this experience? How is this experience of yours?
Yeah, I mean, I like to believe that we're never fully developed as individual creatures. We're always on a journey to find a deeper meaning in our relationships, not only to others around us, but also most importantly to ourselves. And I think that the interplay and the engagement with other people is the best source of not only challenging your own ideals, but also allowing yourself to realize the benefits and the beauty in other people, in other cultures, and in other systems of doing things. And I truly believe that having been so project based in my work, but also in my upbringing and moving around a lot, and having an international intercultural background, where I've lived and who I spend time with, that's given an idea of that the outdated nature of sovereign states and the ideal of belonging to a certain group and not to another group is I think that there's a lot to learn from a more, I don't want to call it spiritual because that makes it sound very high end, very fluffy, but with a more open ideology. And I think so to answer your question, I think there's a huge beauty in allowing ourselves to see other sides of people, and thereby other sides of ourselves.
Yeah, well, Hugo, there's a lot to learn from you. You're a public and a community health specialist, right? So what do you think about the current pandemic situation? Like, how soon are we going to get rid of this?
I want to start with a disclaimer that title, community and public health specialist, is by education, and one that I don't want to put too much emphasis on in anything. But no, definitely that is the title that we've been taught to give ourselves. So I will use it. But I think that it's interesting how you phrase your question. When will we get out of this? I think was what you mentioned, and I think one of the first realities that we need to be facing, and one of the things which I think we need to get on board with, is that there's no going back to normal. There's no once Corona disappears, or once we go back to how things usually are. That's not going to happen. This is such a fundamental shift in how the world operates and how we view movement, how we view disease, again, how we view an existential threat. So I think that our first stock we need to be taking is that things are going to be different now. We can't expect when things go back to normal. But my take on how things might change or might develop, what we need to realize is that even though there's not going back to a normal, there is going back to a routine, which we might grow ourselves into. I mean, there's oftentimes change, or in crisis, then there's often this panic reaction, and then an acclimatization to a new reality. There's a nice anecdote of lobsters, how they shed their shell when they're growing. Often they grow too tight, and then they have to shed it, and so they go when they're naked and when they're without their shell, they go and hide under a rock because they're scared and it's uncomfortable, and they don't know how to operate in this new setting. But as the shell grows, the new shell grows is often a bit too large for them. So once it's grown for them, they wobble out from under their stone, and things are a bit loose and a bit clumsy, and they don't really know how to operate. But they grow into their new shell, and that's what I think that humankind and our society will have to do as well. Grow into this new reality of how we live in a society which has a more open idea, or a more understanding that contagious diseases, infectious diseases can affect the entire world. So I think we'll see huge changes in how businesses operate, large companies operate. I imagine that there might be new roles come into play for people with my experience or my knowledge.
Yes.
Or
Yeah, I think so
epidemiology.
too.
Or big companies might have like a virus expert, or
Yeah.
it's like you have IT specialists working at. We saw with the digitalization of operations, then we had IT people. Now we might have virus people.
Yeah.
I think that we're acclimatizing now to remote working. I think that's only become a stronger part of our everyday, that people have a not only work remotely, but that there's a shift maybe towards a healthier balance in work-life balance.
Yeah.
So my hope would be that that becomes something that becomes reality. But at the end of the day, we're social animals as human beings, and this is a virus, an intelligent virus that has utilized our social nature as its way to reproduce itself, and so it's using our greatest strength, that of being social beings, against us. And so we need to know that that's our weakness, and so that's how we need to adapt to it. But
True.
yeah,
True.
I think there's, so with that of us being social beings, and each kind of group of people having different ways of acting in a social setting, there will also be different ways of addressing the virus. And so it's difficult to compare strategies of Sweden as opposed to other
Country.
in other countries. I will stop because I think
I think we should all, should be optimistic by the end of the day, and hope
absolutely.
that we will come out of this as soon as possible. And recently I was having a discussion with some of my friends, and then we were talking about the digital health in Sweden.
Mm-hmm.
So I'm curious to know, what is your opinion on that?
Mm-hmm. Well, digital health as a notion, the idea of being able to speak to a healthcare professional and receive diagnosis and have your prescription filled via digital means such as this, is something that's isn't new to Sweden. Quite a few different startups started in 2014-15 was when they had that big break, and have taken more and more space in the Swedish healthcare system.
Mm-hmm.
And this is it's very relevant to talk in this particular setting of COVID-19, where things are being more digitalized anyway. But this is not, it's a trend that we're seeing in Sweden and in other countries. But I know that the government of Sweden recently, or this year or last year, put out an aspiration or a goal that they will be world leading in digital health by 2030. So this is something that the government is looking to work with. At the same time, there's with this having this small incubation of digital health has grown into an oversized, not monster, but an oversized creature that isn't contained within healthcare financing in the Swedish system, in the Swedish healthcare financing model. So currently, to break it down and to not make it too complicated, me as someone who's registered in my municipality, in my commune, I go and see a healthcare provider in my commune, and so it's my municipality that pays that doctor. And the same if I go to Gothenburg, then it's still my municipality that pays the Gothenburg doctor, because I am meant to be, my home district is down here in Skåne. So this makes sense if you're talking about physical healthcare, but if you talk about digital healthcare, then this model becomes doesn't fit, because you have you as a private person sitting here in South Sweden, I can be linked to the doctors anywhere in Sweden who are just signed up to this service. And so it's my municipality, my commune that then foots that bill. And so this has led to hugely disjointed and incorrect distribution of finances. The Västra Götalandsregion, so where Gothenburg is included, during 2018 had to pay over 100 million Swedish crowns in healthcare fees for people who didn't see people who were written in their region but visited digitally in other municipalities. So there's it's an outdated health financing system, and so if Sweden is to become world leading by 2030, there needs to be a huge revision of healthcare financing and a different model for digital healthcare and for physical healthcare. But that's in the works. There was a big review that was done end of last year by Karolinska Institute. That's that suggested a bunch of or came with some recommendations of how government legislation should look. And I don't know if that's being prioritized now with COVID-19, but I think that it's something that we will see in the coming years.
Yes, and I think because of this pandemic situation, digital health all over the world is going to grow, and everybody is going to help this in some way or the other.
I think so too. I mean,
yeah. Have you been involved in any projects related to digital health?
A couple, yes. So
in Sweden or in Europe or all over the world?
In Sweden, mostly,
okay.
or only in Sweden. There's been communications with Denmark and Netherlands, but it's first best to in our project that we've been looking at that are on ice, that are lying on ice at the moment, in light of what's going on, and with our expectation that there's new legislation coming out in Sweden. There is room. I do imagine to unbind ourselves from this idea of a nation state, and of course there needs to be a model of financing that allows for healthcare to be paid for by taxpayers and by the state. But I do see huge potential in utilizing this digital model, especially when you're overcoming language barriers, which is one of the main issues that we see in Malmö. Of that, there's a large non-Swedish speaking population, and of those, largely from Middle Eastern countries, who tend to use medical services and visit doctors on a more regular basis than the common Swede. And so there's a higher need, but not the equal demand. So to answer your question, yes, there are a couple of projects in Sweden which we've been looking at.
That's amazing, and good luck to the projects in the future, Hugo.
Thank you.
After hearing all this from you, and I'm quite motivated. But what motivates you to do so much to the world?
Well, that's a very kind question. Thank you. I can't be upset with that. But I don't know. I think there's not much. I don't think there's a lot to think about in it, because from my perspective at least, there's not much that I consider as to this is the reason now why I'm going to do so much good. It's more of a way of being, and I think you call it, you can get involved in the nature versus nurture kind of discussion, but from a young age it was impelled in me that there's one common humanity, and that's what we need to care for. And this is why I'm part of this project here at the Family Project, which most people in their late 20s who are highly educated and ready to go out into the world maybe wouldn't do. But I feel there's a strong connection with making change on a local level that can then be expounded and exponentially increased to the world around. So I think in anything that I aim to do, I look for impactful and meaningful change to a small number, rather than saying let's change the system. And I think that's how you get there anyway. So in my chances to work in Guatemala, most recently there we had the opportunity to work very hands-on with resultant communities. So directly with community leaders and with the women who will be partaking in these health development practices, in the children who will be part of the nutrition schemes. And I think that's to see the impact that you can make, that you tangibly can make, is the best thing you can do. But more than anything, I guess it's not because there isn't this barrier to see between that one group belongs to another, or that we're restricted within our own barriers, or we're within our own limitations. So I think that's where the first step needs to be taken, that we to look beyond our own borders, and to not start with somebody else, but to start with ourselves. And I think once you've laid the foundation within yourselves, where you feel that you are in a good space where you have mental rest, where you understand your place in the world, in relation to yourself more than anything else, that's when I think you can start looking outwards. And I think that I've had facilitated for me from a young age. So that I'm still continuing with, of course.
True. Well, to the audience out there, I think now it's time for you to see what you are potential, like to see what your potential is and stuff. So about I want to talk about youth empowerment, and I want to know what is your take on it.
I think it's good. No, of course, I think it's much like, let's say, much like sustainability. Empowerment is an incredibly important concept, but it's one that has been becoming overused and intangible. So it becomes a buzzword, and of course notions of empowerment and sustainability are important, but I think when they start becoming too much part of global goals, then we start losing what they actually mean. So that's my first take. I think that we understand that it's a buzzword and we need to speak practically about what it means. Youth empowerment is fortunately something that I've been able to partake in actively in most of starting my late teens. I joined a European youth organization called the European Youth Parliament, which is an apolitical organization. So just to mention that it doesn't run politics, it runs personal development. So it's based as a cultural exchange organization for soft skills development, or that's my perspective. You can ask others who I'm sure will have a different opinion, and that's okay. But that's also the beauty of it, that you can take from what you like. And so from what I took from it is these notions of what my own empowerment was and how I was able to find that. And that's both through this intercultural dialogue between different people from different backgrounds and challenge your own perspectives and being able to accept challenge of your own perspectives. I think that's the first step in breaking out of your own shell, is seeing that yourself are flawed oftentimes, or that we all come from assumptions. And so that intercultural dialogue, but also that huge emphasis on personal development and on realizing that you have a voice, that you have an opinion. And I won't go into what the European Youth Parliament does concretely, because that would take too much time. But what's important to know is that it is an organization that aims to strengthen the individual and the individual's beliefs in themselves. That's my perspective. And so my take from my experience in the European Youth Parliament, and what I believe that what's important with youth empowerment is to provide a context, to provide a community with other young people who have drive and who can challenge you and who stimulate you to do things, to engage in anything that's on a healthy level. But also, to give you that space and that platform to say you want to be heard, allow that space for you to speak, but also to give you the tools in which to do so, to learn how to do so. So I think this is now where we start crossing that boundary into where it becomes a buzzword and something that might be used in goal setting without its actual purpose being clear. We can talk about empowerment and as allowing youth to have something to say. So, like I mentioned here in the beginning with the World Economic Forum doing this big stakeholder analysis and saying that youth are important. So let's empower the youth. Okay. Yeah. So that's just saying that we want to hear from them, or that they should have something to say. But the necessary step beyond that is to provide the tools and the learning mechanisms in which for them to do so. And not to say that we need to be trained in what to say, but I think there's such an inherent expectation that just because you're young and if you want to say something, then you should just say it. But that's not often the case, as we know. You have to take very drastic steps, or we have to come in, gather in huge groups, and only then it's important. But I think so. Youth empowerment as a notion, something. My take on it is that it's a foundational for societal development. Period. And needs to both have a platform and the tools in which it's there to empower, to apply them. And with that second part, with them being the tools in which to apply youth ideas, then it becomes far more long term rather than just saying, youth now speak. it takes more time to cultivate these ideas and put them into practice. So yeah, those are some of my thoughts on it.
I 100% agree with you, Hugo. Being a youth myself, so so I completely agree with you. And I would end, and I would like to thank you for your time. It was a pleasure to have you on our show, Hugo. You are an inspiration to me, and of course to the youths in the world. Yeah. And thank you, audience, for tuning in. If you have any questions to Hugo and me, you can send us an email at businesstechtimes@gmail.com. I will also put this email ID in the description below. If you like today's episode, don't forget to share and subscribe if you want to know who's going to be the next guest. I will see you next week. Until then, goodbye and stay safe.